I'm Sienna Bowes. Welcome to my channel, Learning Builds Life. Today we are going to talk about anatomical terminology, which are terms in relation to the commonly used terms in embryology, comparative anatomy, and sometimes gross anatomy. So, let's begin. Our first term is, number 1, ventral. Like anterior. It is towards the belly. That means, again, the front, towards the belly. Towards the belly. Next we have, number 2, dorsal. And dorsal is like posterior. Like posterior. It is towards the back. Towards the back. Moving on to our third term, which is cranial or rostral. Cranial or rostral, which means towards the head, superior. Means towards the head. Lastly, we have number 4, caudal. Caudal, that means towards the tail. And what I mean by tail is like the bottom part, towards the tail. Now you may take a look at the board and see the terms in relation to embryology, comparative anatomy, and sometimes gross anatomy before we move on to terms in relation to body movements. Moving on to terms in relation to body movements. Moving on to terms in relation to body movements. Body movements. But today I am just going to talk about general body movements. In my later episodes, we will talk about body movements regionally. So let's begin. Our first type of movement is gliding movement. Gliding movement. And what is gliding movement? Now in some joints, the bones will have flat surfaces, and the relatively flat surfaces don't allow much of like twisting or turning. They just glide over one another. That is gliding movement. Angle does not change in the articular surfaces over here. And I mean articular surface means the joints. Angles don't really change in the joints. Our next movement is angular movement. Angular movement. And the name itself suggests that angular movement is movement dealing with the change of angles in the joints, and there are different types of angular movements, which are, first we have flexion. And what is flexion? Flexion is reduction in angle. Like you say, this is my extended arm. If I do like this, it's reducing the angle of this joint. That means it is flexion. And the opposite is, from the name itself, it suggests extension. If my hand is in this position and I bring it like over here in this form, this is an extended form. And that means the angle has increased, which is extension. Lateral flexion is the left and right movement of the trunk over the waist. We have number D as adduction. Adduction, that means the taking towards. Like, let's say my hand is kept like this. If I am taking it towards the median line, then it is adduction. And if I am taking it away from the median line, then it is called abduction. Abduction and adduction are opposite movements, and flexion and extension are opposite movements. These were the 5 types of angular movements. Moving on to our next type of movement, which is special movements. These movements happen in specific type of joints, like, for example, the pronation and supination of the radio-ulnar joint. Pronation and supination of the radio-ulnar joint. And what is the meaning of radial-ulnar? It means the joint in between the radius and the ulna of the forearm. The joint in between that is called the radial-ulnar joint, and there are 2 joints in between the radius and ulna, which is a superior radial-ulnar joint and an inferior radial-ulnar joint. And what I was talking about pronation and supination is that if I do my hand like this, it is pronation of this joint, and if I do it like this, this is the supination of the radial-ulnar joint. The next type of special movement is protraction and retraction of the temporomandibular joint. Temporomandibular joint. And what is the meaning of this big word, temporomandibular? It means relating to the temporal part of the skull and the joint in between the temporal and the mandible. The mandible is the lower jaw. This is the mandible, And this part of the skull, approximately over here, is the temporal bone of the skull. The joint in between the temporal and the mandibular, means the mandible, is the temporomandibular joint. And what is protraction and retraction? Protraction is this type of movement, like I'm protruding it out, like that. And when we take it in, like this, then it is retraction of the temporomandibular joint. And finally, it is inversion and eversion of the subtalar joint. And what is the meaning of the word subtalar? It means the joint below the talus. The talus is one of the bones which makes up the feet, but obviously I can't show it on my body since my legs aren't visible. But inversion and eversion of the subtalar joint is the left and right movement of the subtalar joint. And these were some special movements. The last type of movement is rotation. And here also, there are two types of rotation. One is medial rotation, and obviously the opposite, lateral rotation. Lateral rotation. And what are these terms? Medial rotation is like, let's say my hand is like this, and I take it towards my median line, then it is medial rotation. But I take it away from my median line, then it is lateral rotation. Lateral means away from median line. Recall when we discussed about medial and lateral in Anatomical Terminologies first episode. That was all about body movements. Now you may take a look at the board. Hope you enjoyed this episode, and please like, share, and subscribe my channel, and stay tuned for more videos. Thank you.